Buoy Health Insights Hand Tingling. Hello, and welcome to another episode of Buoy Health Insights. If you've been experiencing a tingling sensation in your hands, you might be wondering what's going on. Today, we'll dive into the possible causes of hand tingling, the potential symptoms that may accompany it, and when it's important to seek medical care. Firstly, hand tingling can present itself in many ways, but is commonly described as an annoying, almost shock-like sensation that can travel through your hands and fingers and sometimes even extend up to your neck or jaw. It's commonly referred to as a pins and needles feeling, or like your hand is falling asleep. The cause of hand tingling can vary based on whether it occurs in one hand or both. Tingling in one hand may indicate a pinched nerve, which can happen when a nerve gets caught between two bones or muscles. If you use your hand in the same position repeatedly, like typing or using a mouse, you might develop carpal tunnel syndrome, which also results from a pinched nerve. Tingling that occurs in both hands could be related to more systemic causes, such as vitamin deficiencies, autoimmune diseases, or spinal cord damage. Specifically, vitamin B12 deficiency, autoimmune responses to viral illnesses, and certain metabolic disorders like thyroid disease can affect nerve functioning and lead to hand tingling. Now, someone more likely to experience hand tingling includes desk workers who use a keyboard and mouse for extended hours, as well as anyone with damage to their nerves or circulatory system. Let's go a bit deeper into a couple of specific conditions associated with hand tingling. Ulnar nerve entrapment of the elbow. This is also called cubital tunnel syndrome. Your ulnar nerve, which runs from your neck down into your hand, can get compressed, often at the elbow. The symptoms can include numbness, tingling in the hand and fingers, weakness, and potentially muscle wasting in the hand if it goes untreated. This typically will be limited to the little and ring finger side of the hand. Thoracic outlet syndrome. This condition arises when the space near the base of your neck, known as the thoracic outlet, becomes tight or damaged. It's often a result of trauma or repetitive strain. This can lead to numbness, tingling, pain, weakness, and variations in the temperature and color of your hands. Carpal tunnel syndrome occurs when the median nerve is compressed in the wrist as it passes through the carpal tunnel. This can cause tingling in the hand affecting the thumb, index, and middle fingers. Weakness and pain may also be noticed. Symptoms are generally worse when the wrist is flexed and are often alleviated with use of a wrist splint. When considering the seriousness of hand tingling, mild cases might not be serious, especially if they occur after waking up or resolve quickly. However, persistent hand tingling starts to become worrisome as there could be ongoing nerve damage which may lead to permanent numbness or loss of sensation. A particularly urgent scenario is when there's a tingling in the left hand that suddenly extends to the arm and jaw, as this could be a warning of a heart attack. This is a medical emergency requiring immediate attention. Before we wrap up, here's a quick reminder to always listen to your body. If you encounter symptoms like sudden onset of tingling in the left hand extending to your arm and jaw, seek immediate medical care. In other cases, if the tingling persists, worsens, or is associated with other symptoms like weakness or muscle wasting, it's best to consult with a healthcare provider. Thank you for joining us on Buoy Health Insights. If you found this video helpful, please give it a like and don't forget to subscribe for more health information. Until next time, stay informed and stay healthy.